Hi everyone, welcome. I'm Dr. Alek and this is the Ask Dr. Alek show. And today, basically, we're going to be focusing on acne. As you know, we've been concentrating on pimples, breakouts, and acne with our whole Facebook series as well as on our website. And the reason for that is the majority of teenagers, more than 50%, will suffer from some form of acne or a pimple or a breakout. And interestingly, more than 25% of adults worldwide are actually affected by a pimple or acne and blemishes. And in some people, it can really affect their lives. And the important thing to remember is it is treatable. And we can look at both topical products, but there is more that can be done. And that includes medication as well as laser-based treatments these days. And they give really effective results. I'm going to focus predominantly on the topical approach or your take-home regime. We're going to try and dispel some of the myths around acne. However, if your acne is not responding to a topical approach, one may have to consider some form of hormonal tablet for women or antibiotics, which could be used by both men and women. One can even consider Reaccutane or vitamin A tablets, which has an excellent success rate and can have a very low side effect profile, especially with low doses. Unfortunately, lower doses will take a lot longer to have an effect, but it may be a safer and a better approach for some people. And there are numerous lasers out there today that help to destroy or kill those bacteria and help to reduce the pores, and that ultimately improves the peels and improves the actual acne. And then lastly, one can also consider chemical peels. Both your glycolic and your salicylic acid-based peels have been shown to really benefit and improve acne or people that are suffering from acne and pimples. Now, the basis of your take-home regime and some of the myths I'd like to dispel is firstly, increasing your pimples or exposure of your skin with the pimples and acne to sun is not advised. That will only make things worse. Those blemishes will darken, they will pigment, the healing process may be delayed, and scarring can actually develop from sun exposure. So staying out the sun and using a good SPF is definitely a must. Secondly, don't use greasy products. The products that are full of oil-based moisturizers really should be avoided. And that also goes with if you have long hair, it should never become greasy. And in the shampoos and the conditioners and anything else that you put in the hair should also be oil-free. Basically, granular scrubs. A lot of people with acne or with pimples think that if they rub their skin hard and stay squeaky clean, they'll get rid of all the bacteria and also break down all the pimples. That is also 100% contraindicated if you suffer from acne or pimples. It'll only make things worse for a number of reasons. You destroy the natural pH balance within the skin. It tends to overproduce sebum or oil, and the pores become more clogged up, and with it, you get bacteria and even more acne and pimples and breakouts. So it is important that your at-home regime includes the appropriate face wash. Here we have the Blemish and Age Cleansing Gel from SkinMiles, but the Neostrata cleansing gel is also can be used. It's maybe a slightly cheaper option, but we prescribe both of them when it comes. But use the appropriate face wash. And I think that's the message here, the one that's specifically for acne skin, that doesn't strip away what it shouldn't, but it helps to improve the pores, take away the sebum, as well as the bacteria in the actual sebum and the pores. Then one would like to also add something that works as a moisturizer, but at the same time controls the actual sebum or the oil production. So there's less pores that get blocked up. Here is the SkinMiles Blemish and Age Defense. This really helps to control the sebum, but one can have from the Neostrata range the oil control gel. That will also do the same. And here, as you can see, I'm giving you options from two brands, but we do have patients that combine brands. So they'll work with the SkinMiles and the Neostrata and with an extra SPF. And then we do, even although we might have oily skin, which is producing sebum and resulting in the bacteria or predisposing us to the acne, we still need to have a moisturizer. But it is important that the moisturizer, just like your hair products, is oil-free. It has to be a non-comedogenic or non-acne causing type of topical product. And the Neostrata Sheer Hydration SPF 35 is a really good product to consider using, especially if you have acne or pimples, as a moisturizer. And even although this has an SPF of 35, we still promote or to inform our patients to use the HelioCare Gel SPF 50, because you really want to protect and prevent any burn, especially on those acne or inflamed lesions, because you don't want permanent pigmented marks or even scarring developing. A lot of people think it's also okay to pop their pimples. It really shouldn't be done. It should be done by a professional if it does need to be done at all, but don't do it at home, because it will leave scarring, and in particular those pitted or those indented scars, which become very difficult to treat in future life. Okay, so that's the end of my focus today on the take-home message or take-home regime, how to look after your acne, but also what type of products we have seen produce the best results when it comes to acne, breakouts, and blemishes. And one more word of advice is that if your dermatologist or doctor has prescribed an antibiotic or some form of oral medication, give it at least 6 weeks. Use it every single day for at least 6 weeks and check them. Only then decide whether it is having an effect on your skin and your acne. If not, then go back to your doctor so that further investigations and further medication or treatments can be advised. Okay, thank you for listening. Thank you for watching, and we'll see you next time. Take care and look after your skins. Bye-bye.